We, and the state senate has, with the counties and with the state health, has been doing Narcan training, and so many of your local communities are doing it. It's a Band-Aid. It's because we know that there's hope, and this is a treatable disease, that we want to keep that person alive so we can get them into recovery, get them into treatment and detox. So we know it's not the solution. It's to get us, it's triage, right? In medicine, you have to triage. You got to keep the individual alive so we can get them into treatment. And we're doing some Narcan training today down at Sayville Community Ambulance, directly following this hearing. And we invite anyone who would like to attend to please attend. Next, we have Steve Chasman. He's the president of the Long Island Council on Alcoholism and Drug Dependence, better known as LICAD.
Good afternoon, Senator Croce, Senator Boyle, to all the senators. Thank you for having us today, an opportunity to present. It seems like every time an executive director at the Long Island Council on Alcoholism and Drug Dependence, he gets the unfortunate opportunity to report, and you'll hear from the prior executive in just a few folks, but in 60 years of service, as LICAD was founded in 1956, every time I step to a podium, I get to say, last month was the busiest month in 60 years. So when Dr. Reynolds and I started together in 2008, LICAD, having offices in both counties, we're seeing about 450, 500. Last month, so that's March in 2016, we saw just about 1,200 people come through our offices. Now, the good news is we have developed programs. LICAD was among the first to do Narcan. We've trained over 4,000 people in both counties. We have great partnerships with both county governments, including Executive Bellone and the 24-hour line, where LICAD has been on call for 4 years, 24 hours a day. We've just partnered with Suffolk County. Here's the problem. We could field a phone call at 4 in the morning, engage that person, have them come in or speak to them again at 8:30. Regrettably, even with our partnership with Communities of Solution, OASIS licensed facilities, there are waiting lists across the board. And if there happens to be a bed availability, I'll mirror what everyone else here has said, that the insurance companies with a fiduciary interest in treating opiate addiction or polysubstance use, as we say in the field. What is that? My drug of choice is whatever you got. Clearly, the focus today, as it needs to be, on heroin and other opiates, but allotting 6 days of inpatient behavioral health for the addiction to the most powerful narcotic on the face of the planet is like you got a better shot of winning the Indy 500 with a pair of roller skates. It's just not going to happen. So, and not to make light of the situation, but we've heard it across the country. We've heard it out of the White House. I did hear the National Drug Policy Director, Mr. Balicelli, say, our biggest mistake, we're treating a progressive chronic illness on an increment by increment fee-for-service basis. And of course, people going back to the same, in some cases, dysfunctional families, dysfunctional communities, dysfunctional peer group where drugs are rampant, and we expect monumental change. So access to treatment, obviously continuing to look at the insurance companies and some of our treatment modalities on how, I like what Father Frank said. I mean, 90 days is minimum, 8 months until you can have some semblance of clarity. On the front end of this, education and prevention. This is, we have not seen such a monumental shift in American society since the turn of last century. We called it the Industrial Revolution. The digital and technological revolution is putting anxiety and stress levels, not just for adolescents, but for most of us, and we're the professionals. Unbelievable amount of stress. Maybe there's no coincidence that we're being inundated with stimulation at a rate we've never before seen, that the nation is addicted to painkillers. They're looking for synthetic or pharmaceutical relief. So teaching coping skills, wellness self-management, how to manage stress. Not 45 minutes in the fall, because LICAD speaks to 30,000 students a year. 81 different schools on Long Island. But 45 minutes in the fall and 45 minutes in the spring is not going to do it. Because, you know, I don't know about you, but I hand-wrote applications in 11th grade for college. Now, there's 8-year-olds poised in a highly competitive world, and we're seeing anxiety disorders, we're seeing depression, suicidality, and of course, a whole host of unhealthy behaviors coming about in adolescence or pre-adolescence at a rate we've never before seen. So education and prevention, treatment dollars, so important as they watch their older brothers and sisters go through this. you'll just afford me some latitude. Don't call it a wish list, but things that for a 60-year-old not-for-profit on the front lines of the substance use crisis, these things are not so much wishes as they're imperative if we're going to turn the corner on this epidemic. Continued education for medical prescribers, not just for opioid prescribers, but benzodiazepines like Valium, Xanax, Klonopin being widely abused. I don't know if irony is the right word, but heroin withdrawal, you'll wish you were dead, but it won't kill you. Xanax withdrawal will, and young people are taking them at a rate we've never before seen, and they do bring with it a life-threatening withdrawal. So for all prescription medications, integrated public health and community education and prevention models for schools, healthcare professionals. You know, more and more as we see in healthcare, the cuts that come down from the federal and the state and the county. I mean, you have one school district with one school social worker. And at the height of a crisis, you know, I'm not a public educator. I'm a healthcare professional. But more and more we hear from school districts that there's one social worker or two social workers for 3 schools. They're inundated with need. Sober high schools, sober dormitories. We're behind nationally with this. We are seeing young people catapulted into the muddy end of the playing field of substance use disorders, which is an APA diagnosis. Yes, we're engaging them. Yes, we're getting them to treatment, but we are not supporting them in their long-term recovery. Sober high schools and sober dormitories in Long Island or New York State colleges and universities are so very important. Narcan. We continue to do with Suffolk County. We've partnered. We do a soft follow-up. If you are interested in exploring the 24, 48, or 72-hour hold, if you experience a near-fatal overdose and you're revived by Suffolk or Nassau County or New York State first responder, to have an allotted time to gather your senses. Most people don't know this about Narcan, but when you inject them, you put them into automatic withdrawal. If you do not transport them to a hospital and give them biopsychosocial treatment, they have no choice because of the physical sickness to go home and inject the same drug that nearly killed them to avoid flu-like symptoms for 5 days. So we need to do more aggressive follow-up. Also, the systematic reinvention of the current fee-for-service pay structure. I can't stress that enough. And the last piece I want to talk about, and unfortunately we're seeing it raise its head in both of our offices, young people today, this new generation of injection drug users who were in diapers or zygotes or not yet conceived in the 80s and 90s when we said, don't share needles. So hepatitis C, HIV, other infectious diseases, we are missing the boat on education, and we will see, as we are seeing, the resurgence of infectious disease. We need to do more, whether it's state-run syringe exchange programs or community education and prevention around infectious disease and transmission education. Ladies and gentlemen, thank you for your time.
Thank you very much.
No questions?
Steve, Mike, please, Mike. Steve, very well said. And 1956, I know very well about your founding and your long history. That was the year that my uncle achieved sobriety and founded the Long Island Council on Alcoholism and Drug Dependence, Brink Smithers. And some of that early work and some of that foundation that's been laid is what we're now dealing with the heroin crisis and opioid crisis on. What we learned about primary prevention education, which was so much of the thrust of the Long Island Council in the early days when it was just the Long Island Council on Alcoholism. So I want to thank you for continuing the long traditions of that organization. I think you'd be very proud, and I think it's quite a testament that all of your hard work has kept an organization alive with your predecessor, so that now we have the tools and the resources to deal with some of the consequences of the disease. Thank you. With that, I'd like to introduce Reverend Michael Stanek, the pastor of Trinity Lutheran Church. Anytime, whenever you need to. Thank you.
Good afternoon. Thank you for inviting me, letting me speak. Senator Boyle, Senator Croce, and other senators here as well. Although I'm looking at the panel, it kind of looks like the week after Easter. It starts to, less and less people up there as the afternoon goes on that come and
Battle of
celebrate.
attrition
So.
right now.
I'm somewhat humbled to be here this afternoon as well. I'm kind of new into this formal atmosphere of the heroin epidemic and drug addiction, though from a family and personal standpoint, addiction goes way back for me. And so it's been something that's been very personal to me and to my family. About a little over a year ago, we started to get involved with a planning to go out and meet our neighbors. Simple. Go knock on the door and say hi. We've only been here for 87 years, but we want to get to know you. And as we were doing that and asking them what were the concerns of the neighborhood, they came up with a number of issues, but the biggest issue for us, and at least for me personally, was the drug addiction epidemic and the heroin epidemic specifically. And so we brought together members of our congregation, but also reached out to government officials, elected officials, school officials, community leaders, and said, what can we do and how can we put something together for our community at the most basic level to reach and start to help. And so we invited a speaker to come in, someone who was a former NBA basketball player and college basketball player. I know that touches your heart there, Senator Boyle. And I've even got my basketball sneakers on for you this afternoon. So, but he came and spoke, and as we gathered this together, and the involvement and energy that we got from the community showed how the faith-based institutions can work with the government, can work with the schools, can work with our communities to bring everybody together. And as we started doing this, there was a comment that if you get somewhere up to 300 people to attend this event, it's a free event, this will be one of the largest events that have ever been held in this area. We had over 600 people come that night. On a cold night in January, they came out to hear a speaker, and it was just raw emotion. People who were there were family members, as I've heard here this afternoon, who have lost people to drugs and other addictions, as well as people who have been in recovery for 30 years, as well as someone who's in the midst of their recovery and was with their sponsor that night, just to hear and just try to share and understand what they're going through and how can this be helped for them. And so through that, what I have challenged my congregation to do is to continue to be involved with our community, continue to be involved with our schools. I serve on the ISLP Drug and Education Awareness Task Force. And I want them and my congregation, my laity, to be involved as well in our community and see where we can help serve there. To also be involved in other organizations at Hope House, Talbot House, Jake Cornensdorf with Kathy, who I've gotten to know as well, to try to be involved there where we can help in those who are recovering. And also to look beyond. We're part of the Lutheran Synod, Lutheran World Relief. And, how can we help villages in Mexico that are producing these farms for opiates and growing this? How can we do something to make their villages better and give them better opportunity economically that they would go away from growing a drug that they want to transport to the United States and do something else. So that's the challenge that I have for them. My hope here as I speak is that we can find a way and you can find a way for us to interact on a regular basis. Faith-based organizations are very important. We're touching people. We're touching them on a weekly basis. We are there as they're crying, as they're in pain, as they're in the hospital, as we're in the funeral homes with them. We are interacting with families. And so we know what they're going through, and we really don't want to be there in that situation. We want to be able to, share joy with them and hope with them, which is really why I've gotten so involved in this. Is I've told my congregation, and I tell everyone, I believe in life, and life means from the womb to the tomb, and it means everything, and it means keeping people alive at every stage. So Narcan, keeping people alive, is such a wonderful addition to the fight to keeping life and keeping people alive. But I want to just touch on what I just heard as well. One of the struggles here is that someone attempts to commit suicide and they're held for a period of time because you don't want to send them back into the streets. yet we are sending somebody who's just been given Narcan in an emergency room, and we're sending them right back out into the street to, again, to try to feed themselves at their most vulnerable time. So hopefully the state can continue to look into that, whatever it is. 72 hours to me should be a minimum. I'm hoping that the state continues to look at that as well. So I appreciate your asking me to be here and that I can share some thoughts with you, and thank you for your attention.
Well, thank you for all the work that you do in the community on a daily basis. You're right. Government can't do it all, and it's the organizations and the professionals you've heard in this room and the not-for-profits that have been able to sew together the seams, and we appreciate it. Thank you.
You're welcome. Thank you.
Next is Tony Marie DeFelice from Catholic Charities, the Talbot House.
Good afternoon. I have my 5 minutes.
Go right ahead.
I was going to share this, but I was on my way here, and I was late for my 5-minute testimony time because I got a call from Judith Raimondi. She's from Lindy Cares, and she was working with a family.
Could you just step up to the mic a little? Thank you.
Oh, boy.
Thank you.
The nephew had been taken out of an overdose by a Narcan by a police officer. And as Steve said, when they come out of it, they go in instant withdrawal. So I guess he flailed around and he punched the cop. So he's in jail now. And they were asking for my assistance in getting him in treatment, and they're calling me because they know Talbot House is all roomy and inclusive. And one of the things she said was, "Can't you text the commissioner?" It went through my mind for about a minute, but I didn't. I'll get him after. But him is the example I want to use of how I'm looking for your assistance in collaborating better with the treatment centers and the politicians and the police to better assist them so this Chris F. isn't behind bars. Instead, he'll be at a place like Talbot House. And I also want to talk about medically monitored withdrawal and stabilization. That's what Talbot House is. And you have, I think, 14 left in the state of New York. And it's totally deficit funded. That lady that was speaking before about having the son, she drove around in a car all night trying to find treatment. A place like Talbot House is 24-hour admissions. Deficit funding means that a person like her son wouldn't be told no because he was too high. He wouldn't be told no because he wasn't in withdrawal too bad. He wouldn't be told no because his insurance wouldn't pay. He wouldn't be told no because he didn't meet the 10 criteria. So I just want to ask you to consider continuing funding those deficit-funded programs that provide the type of treatment that the opiate addict needs when they, that small window, how small is that window? It's about the size of a pin. When they say help, we're ready, and we can achieve the goal of getting them into treatment. Ooh, that was short. Thanks for letting me share.
Thank you very much. Next we have, and we are running about 9 minutes behind. I apologize, but I think the testimony we've heard was worth the extra time. John Capola from the New York Association of Alcoholism and Substance Abuse Providers. Thank you for being with us.
Very welcome. Thank you, Senators. I want to just first say thank you for the work that you did to significantly increase the resources that are in the budget that was just passed. And I want to really kind of talk a little bit with the five of you and your peers about next steps. At numerous hearings that the task force conducted over the course of the last several months, one of you would say that X amount of dollars was not enough to address the issue. So I heard the number $100 million. I heard the number $50 million. And those are numbers that have never been uttered before at any of these kinds of meetings. And I'd like to suggest for a moment that one of the things you can do is to continue to say things which would have seemed to be irrational a year or two or three ago. You know, they talk about, you know, as an advocate, people would say to me, John, you have to make sure that anything you say, you know, passes the the laugh test, right? The laugh test. And you know, just how disconnected from reality must you be in order to suggest what you just suggested, right? And I'd like to suggest that on some level the task force has very successfully pushed the envelope. You've moved the conversation to a different place. The governor is indicating that this will be one of his top 4 priorities for the remainder of the session. There would be nothing better than seeing the governor, the Speaker of the Assembly, and the Majority Leader in the Senate trying to outdo each other to adequately address this issue. And I'd like to suggest to you for a moment, what we're not going to do in the next several weeks is add a whole lot more resources to the budget. Every word you say from this point forward is setting the stage for the budget that the governor will propose next October. So we have the ability right now to comb through the notes of this session and every other session you've conducted and to ask yourselves the question, what are the missing pieces? What are the missing pieces in rural communities, suburban communities, and urban communities? And they're all different. And how do we string together a continuum of services that makes sense? And at the same time, you can insist that we're producing really good outcomes. It is completely and totally unacceptable to hear that if you have a cat with a broken leg or an abandoned dog, that we can find a shelter for that dog within 24 hours and some mother has to go, stand on her head in the middle of traffic to try to get attention and try to get their son or daughter approved. That is so completely unacceptable. And I have all the confidence in the world that every one of you understands that and can do something about it. And Senator Boyle talked about his personal experience with one of his staff people. Moved him to a degree that he talked to the Speaker. And I want to thank Senator Murphy, Senator Ort, and Senator Amador for setting up a meeting during session before budget with Senator Flanagan. And Senator Flanagan at that meeting made a commitment to deal with this issue at the leadership level, right? So what we're not going to do with this issue is push it down to a committee where people are going to fight over $15 million. We're going to keep the discussion up at the leadership level, which is where it belongs. This is a conversation that warrants the governor's attention, and he's indicated that he will be paying attention to it, and it warrants the attention of the Speaker and the leadership. And it was this task force that I think pushed to keep that at the leadership level, and Senator Flanagan was receptive. He was very genuine. He spoke from experience from his constituents. He did an excellent job, and he made a promise that we will keep that at the leadership level. So I would just like to suggest to you that moving forward, that you really think a little bit about, and again, I said at one of the hearings up in Albany last year, none of you were around when the system that we have right now was created. So you don't need to defend it. The governor was not governor when this system that we have right now was created. He doesn't need to defend it. And the same can be said of most of the folks in the Assembly. So it is absolutely the case that we should be closely scrutinizing exactly what we have available for prevention, for treatment, and for recovery supports. And I think all of you could draw up a blueprint for what we should have in our schools and what we should have in our communities. All of you could draw up a blueprint which I am absolutely certain would include treatment on demand. It would include people being able to stay in treatment for as long as they needed it. It would include support for families, et cetera. I have no doubt that you know all of the key ingredients, and you've heard it from the people that have spoken here. And I'd like to also suggest, frankly, that if you have the courage to make these proposals that are out of the box, and if you have the courage to not worry about the laugh test, right, all of the people standing behind me will absolutely be behind you. There is nothing, I mean, the mothers and the fathers and the family members that are organizing themselves on Long Island and all across this state having a powerful, powerful voice. Avi Israel in Buffalo, we're learning who these people are, we're learning about their families, we can see their children in our minds when we're talking about these issues. So, they will have your backs, the treatment community will have your backs, the prevention people will. So we really implore you to take a courageous step and really to be able to sort of talk to the governor about, what his ideas are. Talk to the Assembly. This is clearly a nonpartisan issue. So again, I want to I think I'll end there. I just want to maybe pick up on one point, because I think it's a good example. The woman who spoke here from Talbot House just a little while ago, she mentioned 14 crisis centers, right? There are crisis centers in the state that were at one point probably called sobering up homes, right? And these are the places where people went instead of going to jail. They have the opportunity to instantly create additional capacity for detox in communities. There are treatment programs across the state which have space where, if we were flexible about regulations, they could easily add some new beds without adding a lot of cost, right? So you can ask those of us to do prevention, treatment, or recovery supports, what are some creative ways you can instantly give us additional capacity and additional services so that folks will have an easier time getting to services? We have that responsibility to work with you and look forward to doing it.
Thank you very much, John. Appreciate your testimony. Take care, man. Next is Dr. Jeff Reynolds. He's the director of the Family and Children's Association and somebody well known to the chair. Dr. Reynolds.
Thank you for having me today. It would be real easy for me to spend my entire 10 to 15 minutes talking about what good you guys have done, and a lot of really good stuff has happened in the past couple of years, and we're very, very thankful. But there's a lot more that has to happen, and I know that more has to happen because the overdose fatalities continue to increase here in this region in an unrelenting kind of way. The numbers of folks coming through our doors continues to increase day after day. The number of arrests, by every available measure, we know the problem is getting worse and worse by the day. And I think one of the reasons that's happened is we haven't yet connected all of the dots. Early on in this hearing, you mentioned alcohol and the potential legalization of marijuana. And even if we don't legalize it, the shifting attitudes about marijuana that in the context of a heroin crisis that somehow booze and pot are okay. We've got to connect the dots for young people to help them understand the connection between alcohol, marijuana, and other drugs. We should be doing that in an age-appropriate way starting in kindergarten. And when we look at what's happened with the advent of Common Core, many, many districts believe they no longer have the time or energy to do anything that isn't teaching to a test, precisely at a time when we're putting more stress on kids than ever before. And although we've tried to communicate the importance of so-called discretionary activities like substance abuse education, they don't get it. And so there ought to be a statewide standard for evidence-based prevention education, K through 12. And the State Department of Education ought to be enforcing that in a very concrete and focused way. When we talk about substance use, we often separate out the conversation around mental health. And part of the reason we got to this point today is because in this state we have dismantled, because of payment systems, mental health services for young people. We took away a whole bunch of stuff and replaced it with nothing. And we know that when young people have anxiety, depression, or other mental health symptoms, and they don't access care, they find a way to make those feelings go away, which is why at my organization we're seeing 12 and 13-year-olds using heroin. And that's not their first drug. It's because they started smoking pot and drinking, in some cases with the approval of their parents, either tacit or explicit, at the age of 9 and 10. And so we've got to take a look at mental health services and begin to connect the dots between mental health and substance use disorders, especially among young people. We pushed and got the I-STOP bill passed. One of the deals in getting I-STOP passed was that the physician education piece came out of the bill. We all looked at it and said, we've got to shut off the free supply of opiates into our communities, and so we'll deal with prescriber education later. That hasn't served us really well, because I still, each and every day, hear about folks leaving doctors' and dentists' office with handfuls of scripts or handfuls of pills. We've locked up the bad guys. 99.9% of the prescribers out there would never do anything illegal, but they still do dumb things because they don't understand how this thing works. And so if you do nothing else for the rest of session, go back and clean up the issues around prescriber education. We need it now more than ever before. Virtually everyone up here has talked about the reality that we need treatment on demand, and it's got to be high-quality treatment. And when we talk about Narcan, I see a growing backlash against Narcan. And while I have my own feelings about it, sit in front of a family or sit in front of an addicted person who's been given a second chance because of Narcan, and you'll learn to appreciate really what the drug means to lots of individuals and lots of families. But I know of at least half a dozen cases in the past 6 months where somebody was revived with Narcan, brought to a local hospital. In 2 cases, hospitals very local to where we stand right now, and within 1 hour, we're skipping back out to the parking lot with the family in tow saying, how could this be an hour later? And they're dead of overdoses before the clock strikes midnight. So we saved them. We got them to an oasis, a safe place. The families were like, finally, this is my chance for change. And the kid winds up dead before the next morning. That's got to stop. And if that means that we look at a 72-hour hold provision in the law, then absolutely, it's absolutely time for us to do that. I'm tired of explaining to parents who say to me, isn't there a law where if my kid is a danger to himself or others, that I can have him 2PC'd and committed to an institution? And then I'm on the phone with them and I try to explain to them the ridiculous difference between mental health law and substance abuse law, and it sounds ridiculous. And it sounds ridiculous because it is. These kids are a danger to themselves or others, and we've got to address this head on. I will tell you, 5 years ago, I didn't think that way. 5 years ago, I talked about, so practically, how will we do this, and what about the civil liberties implications? All that goes out the window when kids are dying, and they are left and right. I wanted to mention the issue of the budget, and I've been going to Albany for a really long time. And each and every year we went to Albany and we were told, not this year, there's not a lot of money around. But this year, there's a lot of money added to the budget, almost $30 million in new money. Thank you, thank you, thank you. But please make sure the state agency responsible for getting the money out the door actually gets the money out the door, and make sure that each of your districts gets its fair share. The money in the budget doesn't save lives until it's on the ground and working on behalf of our programs and working on behalf of communities. So please stay on top of it. Talk about how you fought for it, and make sure that it gets out the door into our communities. And then finally, we talked about prevention, we talked about treatment. Let's not forget about recovery support. We're the only major metropolitan area in the United States without a recovery center. How come? We have no recovery high school, as you heard before. I happen to chair the Sober Home Oversight Board in Suffolk County, and everything that's been said about sober homes that are anything but is on point. These are ruthless operators who are collecting DSS checks left and right. Families believe that this is an appropriate next step right after treatment, and you've got kids day and night who are dying in these so-called sober homes. New York State Oasis has said they don't view these sober homes as being part of the treatment continuum, and therefore they can't regulate them. Make them regulate them. Recovery is a part of this entire process. And so you've done a lot of good stuff. But there's more that has to be done. Find a way to link prevention, access to good quality treatment, and recovery support as part of a seamless continuum. That's what will get us out of this mess, and quite frankly, that's what's going to position us for the next drug that comes along, because as soon as we proclaim the heroin crisis over, there'll be something else, and God, I hope we're better prepared to deal with it. Thank you.
Thank you, Dr. Reynolds. Next is